A very good afternoon or a very, very pleasant evening from wherever you're joining us on the globe today. A global namaste to all of you. I am truly delighted to welcome you all on this 117th. Yes, ladies and gentlemen, you heard it right. 117th session. The free global online session discussing COVID and the miscellaneous matters. Let us start this session today by the universal mantra, the Gayatri Mantra, to invoke a lot of positiveness, vibrancy, and a lot of energy. Fold your hands, close your eyes, take a deep breath in and out, and let us chant, or any mantra that comes to your mind. So we'll start with the Gayatri Mantra. Om Bhurbhuva Swaha Tat Saviturvarenyam Bhargo Devasya Dhimahi Dhiyo Yona Prachodayat. The sound vibration, the mantra vibration gets energy all over us. Ladies and gentlemen, isn't the power of mantra very, very strong? Today, I'm absolutely delighted to start the session by introducing our awesome speakers. But before we do that, let me tell you a little bit about Healing Our Earth. Healing Our Earth has been running on since the pandemic started, and you know it's the 117th session today. This was all with the inspiration, motivation of our producer, director, Mr. Neil Kumar, wanted to connect the whole world during the pandemic, to spread the message of positivity, to inspire people, to inform and educate people. This is what the main mission of Healing Our Earth is. So we've had amazing speakers on over the years. We have had amazing speakers, amazing hosts, amazing family of Healing Our Earth. And today, discussing the COVID miscellaneous matters, we have speakers lined up from all over the world. And our very first speaker, we take a journey to India. And guess what? A lot of restrictions have been lifted. So it's very easy to travel into India and meet our speaker over here, Dr. Tariq Jagmag. Dr. Tariq, are we connected? A global namaste.
Hi, global namaste to you too.
Okay, so we are all connected. We can hear you. And I would love to introduce the speaker today to the whole globe who is on with us on various social media platforms. Dr. Tariq is pursued the field of psychoneuroendocrinology, that is the PNEI, over the past 15 years. He is currently the scientific advisor at Gloderma Lab Limited, a dermatological pharma company and its sister concern Herbicide to develop low-dose cytokines. He's associated with FOSIS, which is the Federation of Clinical Immunology Societies. He has 2 international patents on his name and is developing new and innovative products. He conducts regular training programs for doctors on basic immunology, role of immunology in various diseases and their pathways, different cytokines, and homeopathy remedies and treatment modalities for several diseases. His expertise and in-depth understanding of immunological pathways, along with their effects in the various chronic diseases, has enabled him to help many doctors with their patients across the globe to get better from chronic disease conditions. So here we have Dr. Tariq, who is going to be actually telling us all about COVID and the miscellaneous. So Dr. Tariq, a warm welcome, and shall we have introduced you, and shall we make the start of the session with you today? Welcome on board, Dr. Tariq.
Thanks, Doc. So let's start with a few things that I'd like to talk to. My topic for today was about fatigue in COVID. And I'm sure all the viewers at home and people on the panel as well have experienced it, that when they do get COVID, they get very severe amounts of fatigue. And it's not just the fatigue that I want to talk to, uh, that I want to talk about. It's also the associated damage that fatigue causes in the body. For example, you can get arthritic pains, you can get prone to strokes and heart disease after COVID. So this entire gamut of symptoms, from the headaches after COVID, the fatigue after COVID, the palpitations that one gets after COVID, the heart attacks and the strokes which happen after COVID, there's a certain mechanism which causes all of it. And we are at our company wanted to investigate how this happens. So we have our own rat testing labs where we actually test rats and find out molecular pathways which are associated with COVID. So we have a published paper now on this, and we have developed a pill which not only kills COVID, but also treats the side effects that COVID causes in the body, and one of them is fatigue. So I'd like to go about explaining what our pill does and how this COVID causes fatigue. So let's just imagine that you have an infection entering your body. For example, it's COVID. Now your body turns on a burner in order to fight off these infections. That burner is basically oxidative stress, where your body starts to burn the infection. That's why one of the side effects is fever. When the body puts the burner on full blast, it also causes damage to itself. And that damage to itself is what COVID is causing you. That's why when you take corticosteroids, when you're having severe COVID, you feel that the inflammation is coming down, and some patients do respond to corticosteroids because the steroids are basically dampening that inflammation down. But steroids, what we found, have very serious side effects in patients. For example, they increase blood sugar levels, and corticosteroids also cause severe fatigue as well. So we wanted to develop a medication which not only targets COVID, kills off the virus, but also dampens down the inflammation so that you do not require any steroids during your treatment. And that's what our published paper shows. So I'm just going to go on to my published paper to show you what we did. Yeah, so this is my published paper. I hope you can see it on your screens.
Yes, we can see that quite clearly.
Right. Thank you. So this was published in the Journal of Inflammopharmacology, and it shows the anti-inflammatory and the anti-COVID effect of our novel polyherbal pill that we made, which is called as Imusil. It modulates oxidative stress, basically decreases that burn that is there in your body. And because it decreases the burn, it treats that one very strong side effect of COVID, which is COVID, which in COVID means fatigue. And even in patients who have recovered from COVID, they have fatigue, which this treats. It also decreases inflammatory mediators, for example, COX-2. COX-2 is a part of an enzyme which increases when you have a viral infection or a bacterial infection, and it tries to burn the infection off. And when COX-2 increases too much, you can get heart disease, you can get kidney disease, which is one of the common things that happens after you get COVID. And it also decreases the cytokine storm, which is where you normally require steroids to dampen it. So basically, what does this pill do and what is it used for? So when you have COVID and you take this pill, it has a very strong effect on COVID. In fact, it kills off 71% of the virus in just under 2 days. So it is one of the strongest antiviral pills that's there on the market. It is almost comparable to the effect of the Pfizer pill against COVID. And it's basically just a polyherbal pill that we've made. At the same time, unlike the Pfizer pill, it decreases the inflammation in your body so that you don't burn out. This is right when you're having COVID. It will decrease your fatigue, it will decrease your joint pains, and will help you recover. But it also helps in patients with long COVID, those ones who have persistent symptoms of fatigue, headaches, palpitations after COVID. These patients have constant oxidative stress happening in their body. The body has forgotten to put the burner off. The burner is on during COVID and it just doesn't go off. These patients end up getting fatigued, they end up getting prone to heart attacks. In fact, 55% of patients after COVID end up getting cardiac problems within a year after COVID, even if they have mild COVID. So this pill is protective against those conditions, and it improves the person's energy levels. So through our experiences, we have found that the patients who've taken it have recovered from COVID very fast. Their fatigue levels have improved very, very rapidly. And many of the patients who had diabetes after COVID, we were able to reverse the diabetes completely within a span of a month to at times even less than a month after it. This pill is also great as an antioxidant. In fact, we have developed a test also for the oxidative stress. So through the urine, we can measure the oxidative stress marker. When we give a pill, we actually find the oxidative stress marker decreasing. We've seen that there are so many antioxidant pills which are sold on the market. You have vitamin C, vitamin E, you have a complex of various herbs which can be taken like green tea. But none of these antioxidants actually work in the body because you don't know whether they're actually reducing your oxidative stress. Through the test that my company has developed, which is now internationally recognized as a marker, we can actually check your oxidative stress lowering. And if you really want to not grow old, the first thing you need to do is to decrease the burn in your body. So by decreasing that oxidative stress in your body, you can actually delay your aging process. You can stop yourself from getting diabetes. Every patient of ours who has taken our Imusil pill for COVID and its post-COVID complications has continued to take the pill because of its effect on belly fat. With every month that they take it, the amount of belly fat that they have keeps decreasing. Because again, belly fat is a marker that your cells are becoming insulin resistant. And the insulin resistance is happening because of the fact that you're having oxidative stress. So with this one pill, we've been able to target not only COVID, but also long COVID. And also as a lifestyle drug, we can help patients to take it as an antioxidant. It has no known side effects. The only thing that we do is we check the patient's blood cortisol before we give it. If the patient's cortisol is low, then we don't usually give it. We give some other things like ashwagandha in the beginning to improve their adrenal fatigue. And then we start the patient on half a tablet and slowly increase the dose. So this is what I want to talk about. The important message for people at home is that if you're having long COVID, where you're having chronic fatigue, you're having palpitations, this is the method to treat it. You have to decrease oxidative stress. By taking in vitamin C or vitamin E, you're not going to be able to do it because the enzyme that controls oxidative stress is called as NOX2, and it is that enzyme that you need to target. By taking antioxidants like vitamin C and vitamin E, you're not doing yourself any good because the cause of the oxidative stress is the enzyme NOX2, which is developing the oxidative stress. And you are just taking antioxidants to eat away those oxidants which are coming out. You're not blocking that enzyme. If you don't block that enzyme increases and causes vasoconstriction to your blood vessels. So you start having palpitations in your heart. You start having elevated blood pressure. It goes into your pancreas and starts killing off your pancreatic cells, because of which you end up getting diabetes and pre-diabetes. And it starts causing you tremendous amount of fatigue. So that's what I wanted to talk about. Do you have any questions for me, doctor? You're on mute.
I'm just going to unmute myself. Thank you. Wow, this is amazing information. So thank you for sharing this. This sounds like a magic pill. And it grabbed a lot of attention of mine while you were saying a few things. So I'm going to ask you a few questions as we go along with this. First of all, I just wanted to say that Imusil has recently been discovered, correct?
Yes, so our paper got accepted and got published last month. It got published on the 25th of Jan last month.
Yeah, so from the papers I read over there on the introduction there, that it was presented on September 2021 and received on, the formalities were complete December 2021, and then everything was published. So yes. The study of this particular drug, Imusil, has taken place over a period of, say, 1 year?
2 years. It took us 2 years to create it. And the reason why it took 2 years, because the entire extraction process of removing those molecules from the drug, which work on these enzymes, took us around 2 years. So it's not just taking 3 herbs and putting them together, but it was a very complex process of doing it. We were aided by the International Center of Genetic Engineering in this. We were aided by the Indian Institute of Science and by the Indian Institute of Molecular Technology in actually doing all of this. So it took us 2 years to do this.
That's amazing. They're obviously well thoroughly researched and then brought out into the market.
Thank you. Yeah, we did that.
Yeah.
We did our own
Next.
rat studies as well.
So, pardon me?
We did our own rat studies as well to check the efficacy on rats, and it's now an approved drug in India, so it can be used in India. We are tying up with companies to distribute it in India as well.
Okay, great. So in animals, in research studies, a lot of animals like rats are used. How about, is there any research study done on humans having had the Imusil and responding to all the benefits that you have spoken about?
Yeah, so we have done around 35,000 to 36,000 human patients with it. And because it's a polyherbal and these herbs are already approved, we did not have to actually conduct a human trial on them. So it got approved just based on a published paper on the rat studies.
Great. Okay, just for the benefits of the viewers again, if you can, you said it's polyherbal, the three herbs that are used over here, I believe one is ashwagandha, is that correct?
No, we haven't added ashwagandha. If you have adrenal fatigue, then ashwagandha is a herb that helps. But otherwise, the three herbs that we've added are a herb called as kutki. There's one other herb called as tinospora, and a third herb which is amla. But it's, as I said, it's not just the three herbs, it's the entire extraction molecules that we take out. There are currently 87 molecules in the pill which have the effect that we want.
Wow, that's amazing. And regarding ashwagandha that you mentioned, you said if one is suffering extreme chronic COVID symptoms and you check it with their cortisol levels, if they are low, then you start them off with ashwagandha first.
Yes, absolutely. So
Great.
if you have adrenal fatigue and you're checking that your cortisol is low, ashwagandha helps to complement the effect of the pill, because a pill is basically putting a brake on inflammation and at the same time it's killing off the virus. So it's trying to do both things. It's antiviral and at the same time it's putting a brake on the amount of inflammation that your body creates in order to kill off the virus. But it requires support from your body's natural cortisol. So if your body's natural cortisol is low, you need to upregulate it by things like ashwagandha in order to balance out the inflammation.
That's amazing. Now, you also mentioned a little bit about the steroid intake or the steroids that have been prescribed, and you talked about the use of steroids and its side effects.
Yes.
One of the major effects you mentioned was obviously on diabetes. Is that correct?
Correct, absolutely.
Yeah, so steroid also causes a bit of a haywire with the diabetic control system, but also on the bones. Would you agree with that, that there's a lot of osteoporosis?
For the short-term use in COVID, there's no osteoporosis, but there is a very dangerous issue that happens, that these patients end up getting clots in their blood vessels because of the steroids and they get necrosis of their bones. So you could start having avascular necrosis of your bone after taking a dose of steroid during COVID. So this can manifest as severe pain in the hip joint, which will all of a sudden start. And when you get a scan done, you see that there is necrosis of your bone. There's no treatment for it. You have to have a transplant done over there. I mean, you have to actually cut that bone out and put a new graft over there. So the side effects of the steroids can be pretty bad. In fact, most of the cases I've seen who come to us for treatment are basically coming to us because they've taken steroids after COVID and have developed diabetes, diabetes, and also have developed necrosis of the bone after it.
So the necrosis of the hip bone, you've noticed it quite a bit, have you? With the
Yes, quite a lot.
Wow. And this symptom post-COVID, the chronic fatigue has been affecting people a lot more.
Absolutely.
And is there a percentage that you would be able to sort of give us by saying that if one has suffered COVID, these many percent of people will suffer chronic fatigue as a result of COVID?
So the US data shows that around 40% of patients who have suffered even from mild COVID, where they were almost asymptomatic, can suffer from post-COVID or long COVID symptoms. And up to 55% of patients who have suffered from COVID will end up having some sort of cardiovascular issues within a year after COVID. And these cardiovascular issues are again because of this malfunctioning NOX2 enzyme which we have targeted. Okay? Aspirin does not help these cases at all. There have been so many studies showing that aspirin and taking blood thinners have absolutely no effects in preventing cardiovascular risk after COVID. It is the singular enzyme which causes it. You see, this is the enzyme which helps to control the amount of angiotensin 1,7 in your body. Angiotensin 1,7 in your body is a vasodilator, dilates your vessels. If this enzyme goes very high and produces too much of ROS activity, you don't have angiotensin 1,7, you just end up making angiotensin 2, and you vasoconstrict your blood vessels. So all the blood vessels going into your heart end up getting constricted, and you end up getting heart disease after COVID.
Okay, yeah. So in fact, from the earlier conversation that you had, and you mentioned almost 55% of COVID patients end up getting some heart conditions. And I was going to ask you, how does that work? But you very well explained that. So thank you for that. And also, one of the main things about COVID and affecting the heart rate and everything. So is there any data or statistics that shows male versus female? I mean, are males more exposed to COVID, suffer heart conditions, or is the gender ratio equal?
So men usually suffer more severe bouts of COVID, but there's no data to show whether in long COVID patients there are more male patients than female patients. Obese patients suffer the most because when you are already obese, you have a lot of angiotensin or ACE2 receptors which are soluble and are floating around in your blood. So when the virus attacks you, it binds to those floating soluble ACE2 and lingers on in your body. So any condition where you were already inflamed, like you were obese or diabetic or hypertensive, you have a lot of soluble ACE2 in your body, and this gets targeted by the virus, and you end up having long COVID symptoms. Also, you must keep in mind that vaccination side effects are overlapping now in patients with long COVID, where you will see patients having COVID, then they went and took the vaccine, they got worse. They took the second dose of the vaccine, they got worse. Then they took the third dose and they got even worse. So you have an overlap between the vaccine and the side effects of COVID happening together. We have so many patients calling us up saying that we have chronic fatigue now. We can't even walk. We're just lying like that in the house the entire day. We are not able to move. And then when we send Imusil to them, within a few weeks, their fatigue goes off, their heart rate comes down, and they feel so much better.
And that's quite interesting, where the symptoms of chronic fatigue are prolonged. So like you can not interesting that they're prolonged, but a lot of people are suffering those long-term effects of it. But is there anything one can do that why one body is experiencing a lot of chronic fatigue and why one is not experiencing? Is there some kind of data whether the human body is stronger immunologically or not? Is there any data why one is suffering more than the other?
So that's what we have developed with this marker that we have now, which is an oxidative stress marker. You can stay in your house and just give a urine sample, and using the urine sample, we can calculate the amount of oxidative stress in your body. So by understanding this, we are seeing that patients who are more oxidatively stressed, have more severe bouts of COVID because their NOX2 enzyme was already upregulated. They were already inflamed, and now they have an agent which has entered their body, which is causing them even further inflammation. So the more inflamed you are, the worse it's going to get for you. And obesity, hypertension, diabetes, these are nothing but inflammatory disorders in your body.
Yes, thanks. Thank you for that. So also my other question, the next question was linked to the first topic you talked about, people reacting more with the COVID vaccine and their reactions get worse after the first, second, and the third. So it's like a catch-22. What do you do? Do you take the vaccination and suffer the side effects of it, or do you just get on with it? What would you say to that?
See, there are some studies that show that vaccination helps to treat long COVID. So there was one Pfizer trial that showed that the Pfizer vaccine treated long COVID in about 26% of patients. But in the rest of them, it either made it worse or made no effect at all. So how do you calculate whether you fit into that 26%? I don't know. You simply have to take the shot and then wait to see if you're going to get worse or better.
I think it's like touching the hot iron and then experiencing the feelings of it after, isn't it?
Absolutely. And also, I have patients who say that we survived because of the vaccine. So we took a few doses of the vaccine, 2, 3 doses. Then we got COVID and we were almost dead. And then finally we were able to recover, and that's all thanks to the vaccine. That seems highly doubtful that you had to undergo all that stuff to get benefited by the vaccine. The vaccine should have protected you completely. It shouldn't have nearly killed you and then say, oh yeah, thanks to the vaccine.
Yeah, so
So
true.
that data is a little dubious, to say the least.
I'd like to pick your brains on one more thing. People are getting vaccinated, the first vaccine, the second vaccine, then there's the booster vaccine. And now a lot of patients, those are vulnerable due to underlying health conditions, are getting a fourth vaccine. What do you think
Yes.
about that?
So I think that the new vaccines which are going to come out in the next few months are going to be the nasal vaccines. And the intranasal vaccines will solve this problem of taking booster doses. So even if you've taken 3 doses of the vaccine till now, and then you take the intranasal, it will protect you. You see, the reason why the vaccines that you're taking don't work very well to protect you against COVID is because they trigger an antibody called as IgG, which is when the virus has already entered inside your blood and is causing you damage. That's when the IgG works. But you ideally need a vaccine which gives you an IgA antibody, which is on the mucosa. You see, the virus is entering through your nasal mucosa, so you need it to work through your mucosa. So the intranasal will be actually a game changer here. You'll just have to take a puff of it in your nose. And when you've already taken the booster dose, which is the IgG component of your antibodies, the IgA will be highly effective to protect you against COVID. So I think this is the future of the vaccine rather than just keeping on taking 1 dose after the other.
Yeah, that's hopefully that does come out soon enough so that we can all start taking that then, rather than injecting ourselves with chemicals that we may not actually need and then reacting to it quite badly. Great. Now, you know what? I also had this, I'm going to ask you this question again because the paper has disappeared. And for the benefit of the viewers, once again, the 3 herbs that you talked about that are in this Imusil, could you please repeat them?
So the herb is kutki, which is
Kutki.
Kutki. Then there's guduchi, which is also called as Tinospora. And the last one is amla, which is your normal amalaki. So on the surface of it, the 3 herbs seem simple enough, but I would advise you not to try to take them by yourself because each one is very dose specific and the polyphenols in it also have to be extracted very carefully. If you overdose on Tinospora, you could have liver damage. It's one of the causes of having liver damage in COVID patients who've been taking these herbal supplements because supplements have a lot of Tinospora in them and it ends up causing liver damage. So it's a very hot topic, and when I explain to allopathic doctors that my pill has Tinospora in it, they're like, oh my God, it's going to cause my patient damage to his liver. It actually doesn't. My pill actually benefits the liver. But if you take Tinospora just like that, you will cause yourself damaged liver. So please be aware.
Yeah, so it's nice to know the names of this, but ladies and gentlemen, don't start going to the herbal stores and collecting all those 3 herbs and start taking them on your own. They have to be very, very, very dose specific.
Yes.
Yeah. So here on our panel, we also have quite a few well-known people here. We have Dr. Mukesh Batra, as you probably know, a world-renowned homeopath who has also done a lot of work during COVID. Not just producing the homeopathic remedies for it, but obviously distributing them at a very, very, in fact, voluntarily distributing a lot of COVID medication to help those patients. So if we can just get a little opinion from Dr. Mukesh Batra. Dr. Batra, welcome onto Healing Our Earth. A global namaste to you.
Global namaste. It's so wonderful to see you, Lalit, and thank you for this opportunity.
Not a problem.
I must say that it's very, very topical because, Omicron is still here, but there are always variations that are likely to come, variants which are likely to come, up and, unless nobody's safe, unless everybody's safe. That's actually the philosophy of COVID, that unless all of us are protected, and I think a lot of the buzzword really is immunity. So how do you really build immunity? So let me just say this in 2 ways. And, let me divide this from a homeopathic point of view into 3 parts. The first part is prevention. The second part is early treatment. And the third part is long COVID, which I just heard about as well from the other panelist. So the first part, as far as prevention is concerned, homeopathy has always been in the forefront of preventive medicine. Unfortunately, not so well recognized. When the Spanish flu took place about 100 years ago, the mortality rate with the traditional medicine at that time was 30%. With homeopathy, it was under 1%. And then there are examples of this all over the world: leptospirosis in Cuba, and so many other, bird flu in India. There are so many other kind of such examples. And in India, we've used arsenic Al 30, which was recommended by the government of India and the Ayush Ministry, taking 5 pills twice a day for 3 consecutive days every month to build immunity against COVID. And there's a lot of research that has been done. Half of the Gujarat population, almost all of it, was given 6.5 crore doses of arsenic Al. There's research that is done with people who were pre-COVID and they never got COVID after taking medicine, this homeopathic medicine. So there are lots of clinical research that is available, and that is something which still is very useful for people. And we also, as you mentioned, we kind of donated about 1 crore doses free to the entire Maharashtra police force plus to NGOs during the first and second waves. So this is about the prevention part. The second part is the early symptoms which are there, particularly for Omicron. The irritation of the throat, the little bit of cough, running of the nose. So it's very difficult to differentiate this between flu. But what I tell all my patients here in India is, if you get symptoms like this, you presume that it is Omicron. Don't wait for tests to be done. At least isolate yourself so that you don't spread infection to others. Because the symptoms are very similar, but it's so infectious that almost everybody's getting it. So again, homeopathy, because of the symptoms that are there, so medicines like arsenic Al, belladonna, all help very well in the early stages. The success thing, I think, of all this is when you actually recognize when you need to move to hospital. It's very important that you actually catch it at the right time, and you can then get treated so that you don't get into some severe complications of COVID, particularly those who have comorbidities. So, those who are diabetic and those who are overweight, and, a lot of us are during this period. The last part is long COVID, where you get insomnia, diabetes, mental problems, depression, anxiety. Research was done by the Indian Psychiatric Society, and it showed that 25% increase in anxiety and depression among patients during the COVID period. So, homeopathy, being mind and body medicine, is very useful for this. So I think, these are just the kind of, experiences I've had also by giving preventive doses to almost 2 crore people across India, and finding it very useful also in the early stages and also for long COVID, especially for lingering coughs. Lots of people, I had some VIP coming the other day having a very severe cough, trying all sorts of medication, and it just wouldn't go. And with homeopathic medicine, in a couple of days, she was completely all right. So I think, there are actual examples of this where long COVID and side effects of COVID can actually become all right with what we call complementary or alternative medicine. And I think people should actually try it rather than accepting it as just an acceptance.
Yes.
A lot of people just accept it and then they just want to live their life with it. But, that can go on for a few months and few years. So I would say that, just because there is no cure for something in a particular system of medicine, doesn't mean it doesn't exist. So please do discover, please do try. And as long as it's clinically proven and works for people, take what works for you.
Correct.
You can't throw the baby out with the bathwater. There are just such few, remedies available, and they're all unknown. I'm saying, just look at the last 2 years, Lalit. We started with some kind of medication, which we said was actually for worms. And then we said that, because the president of a country took it, it worked very well. And then few months down the road, we said it was useless. And you can do this with every kind of medicine that was tried. So, I think medicine is on a trial over here, and we're just kind of evolving it, and we're just experimenting with human bodies. That's really what we are doing. And ultimately, yes, I think I tell my patients, that what you can do is you can delay getting COVID. So the longer you delay, the better your chances of survival, because by that time, some medicine would have been found out. But the first couple of years is always experimental. So that's all what I have to say, Lalit. Thank you for the opportunity and for giving me this time. And
More than welcome, Dr. Batra. Thank you very much for giving your advice. And we all know that as a preventative, homeopathy is doing very well and extremely well during COVID, that a lot of patients have been helped. So great bonuses to homeopathy and the benefits it's giving. And thank you for all your good work in the contributing towards COVID and everything over the last couple of years. Thank you.
Take care and keep up the wonderful work that you're all doing. Cheers.
Thank you very much. Thanks, Dr. Patra. Dr. Tariq, my question to you while we were discussing was, so Imusil is very effective, as you say, and currently. Now, what about, as mentioned, the different variants of COVID that are coming along? Do you think Imusil will be as effective to other variants, or is there a particular variant only?
So I'll explain how our testing was done. So the testing that we did was done on these cells known as the Vero E6 cells. Now these cells have the ability for the virus to latch on any virus, whether it is Omicron, Delta, influenza, whatever. And the cells have an ability to make a cytokine called as interferon beta, which is a cytokine the body makes in order to kill off viruses. So when our Imusil was given to these cells, the cells were able to make interferon beta by themselves and kill off the virus. So whenever you want to check any antiviral against any species of virus, you want to be able to check whether it increases the host's antiviral defenses or not. So Imusil is a generalized antiviral. In fact, it is such a good antiviral and anti-inflammatory that even in cancer patients, it shows amazing effects, because in cancers also there is tumor-mediated inflammation which happens. And the same pathways which used to kill viruses also to a certain extent kill cancers as well. So hence it is useful for not just as an antioxidant, as a general health thing, but you can even use it up to the extent of taking it in cancer patients as well as in all different types of viruses, including dengue, including influenza, including COVID of all different types. It's not actually creating any toxin in your body. It's just upregulating your body's own ability to go into a state known as the antiviral state.
Correct. So that again, with no side effects coming as by taking Imusil. Is that correct? Is that what you're indicating?
Yeah, the only side effect that people experience is their waist gets smaller because it decreases their abdominal fat. So you start losing your love handles.
But isn't that a very good thing for the cosmetic about the human body?
That's why all our patients who have started on it for COVID have continued it. We haven't had a single patient who said that I want to stop it, because it continuously keeps shrinking their waist size.
Now, I've got a question for you, probably just as a little joke. So if you don't have COVID, if you haven't suffered COVID, if you don't have chronic fatigue syndrome, but you want to lose your love handles, can you take Imusil?
Yeah, you can. So quite a lot of our cases are simply taking it because they want to keep their waist size intact and they want to decrease abdominal fat. That's what they're taking it for.
So I think more than helping the chronic fatigue, all those people who are listening to us, and if they want to reduce belly fat, Imusil is the way.
Exactly. So this was like our Viagra moment, we made a pill for treating COVID and we found it has other benefits because patients kept asking for it. We're like, why do you want it? You're already cured. And then they told us, oh, our belly fat is going.
Wow, that's very interesting. Okay, I'm registering my name to get my Imusil then, eh? Wonderful. You know what? We also have a couple other doctors which we would like to engage them into this conversation. But before we do that, Dr. Tariq, how widely has this drug Imusil been used globally? Is it something that has just been recently published in the 2021 papers and it's all over India that it's making such a loud noise? Or is this a global drug that has been used?
So we are right now looking for distribution partners in various countries. So if there's anybody listening outside India or even in India who wants to become a distribution partner, we are more than open for that. You can simply ping me on my email or on my WhatsApp number, and you can definitely have this as a conversation. Yeah, so we are looking for partners all over the world.
Sure. So this actually fulfills our mission at Healing Our Earth, which says we want to inspire, motivate, promote happier and healthier, love handle less lives for people, and a harmonious global. We want to create this harmony over the globe. And this is how all the people from various different backgrounds, from different multicultural, diverse online content is being shared. People get connected this way and we can get so much information. So absolutely, Dr. Tariq, the people who are listening to us on various social media platforms, hopefully there is one listener over there who wants to connect, or more listeners who want to connect with Dr. Tariq. Connect with us on www.healingoverearth.com, and we shall certainly be able to put you through to all the connections of the speakers and the hosts here. So lovely, Dr. Tariq. We have the two doctors over here. One is from Malaysia, Dr. Julie Tay from Malaysia. Dr. Julie, tell us your experience about this particular drug, if you know more about it, and what you are thinking about chronic fatigue and COVID.
I also want to point out Dr. Kat just raised her hand when you said about the distribution. And we are lucky enough in Malaysia to actually have access to Imusil even before the published paper. And I myself have started it on some of my family members, and I've tried it myself. And I've noticed that my alertness, my mental clarity has definitely gone up since I started on the Imusil. I don't have much weight to lose, but I think you need to be on it for, how long do you have to be on it, Dr. Tariq, for you to notice the weight release?
So I take it every day. I take 2 of my pills every day. And if I don't take it for maybe 3-4 days, I start finding that my appetite goes down, which means that I can't digest that much of food. And I start feeling a little bloaty. So then I take it every day and it keeps me nice and hungry. The good thing about it is that I can eat as much as I want after it. That's what I like.
Nice.
I think, Dr. Tariq, Imusil is going to get a lot of popularity, not because of its effect on chronic fatigue, but its loss on the love handles and the belly fat.
Yeah. That's what people are taking it for. Also, we've used it along with one other pill of ours called as phospholipid, which is a phospholipid lipid emulsion which treats fatty liver. So we've helped many patients who are even on the transplant list for the livers be able to recover using both Imusil and phospholipid. So it's not just the benefit on the love handles, but also on fatty liver disease, which is a serious problem that affects Asian countries because we're having a lot of palm oil in our diets.
Okay, great. So yeah, following on from the question from Dr. Julie, she said, or she asked, how long does it take once you start taking the Imusil to actually notice the weight loss?
It just takes about 2 weeks. It's not causing you weight loss, it's causing you waist loss because it is the 2 kgs of abdominal fat which is basically bringing you down. The rest of the fat in your body you can actually lose with exercise. But if you see people going to the gym, they have their belly stay the same and they just get muscles, you know. So they're trying to hide the belly with the big muscles, but the belly stays just about the same. It actually doesn't go inside. So it is that belly that we target. It's not really going to cause you any weight loss.
Sure. So I take my word back about weight loss. It's the waist loss, not the weight loss.
Exactly.
Wonderful. And how readily is this medication available in India? Is it over the counter? Is it prescription or what?
So right now it is Ayush approved, and the only person who's distributing it is just about 5 or 6 of us doctor friends who are doing it. As I said, we are still trying to find distributors for it. So we are in talks with various companies who are going to help us to distribute it. If you are a listener at home and you're a part of some pharma company who wants to help us in this venture, please inform us so we can use your help to distribute it. The kind of hurdles that we get is we've spoken to a few hospitals in India, and the major hurdle that they find is that the doctors in India, since they're so allopathically trained, they basically just want to give the patient B complex for the fatigue, or they want to give a normal antiviral pill like ivermectin or maybe some steroid or some paracetamol to the patient. They don't want to use the herbal because they feel that since it's classified as Ayush, it is below their dignity to use an Ayurvedic pill. What they don't realize is this published paper was in the International Journal of Inflammopharmacology, which is an allopathic journal. It publishes the top end papers of allopathic drugs, and our drug was treated like an allopathic drug. We were asked to identify each and every molecule in the drug, which we did with the Indian Institute of Science, and we ran so many HPLCs and FITRs to be able to identify each and every single molecule. So it's actually at the power of an allopathic drug and not just a herbal pill.
Yes, and I think that battle between mainstream medicine and complementary or alternative medicine is always going to be a challenge, isn't it?
Absolutely. Now you see there's a drug called Live 52 in India. It's a pill which is commonly prescribed by doctors for inflammation of the liver. I myself had got Hep A when I was in college, and my liver was really inflamed. And I used to take Live 52 every day, hoping that my markers would come down. While the markers did come down, my appetite and things like that were really bad. I had chronic anemia. We finally actually tested the pill to see what it does, and what we found that it actually kills off a few of the cells of the liver which are producing SGOT and SGPT. So it, instead of actually benefiting your liver, it's actually killing off the cells, so they keep quiet and they don't make those inflammatory enzymes. And because of things like this, the doctors in India are very apprehensive. Also, papers on tenospora show that it's damaging the liver, so they're scared, oh, this pill is going to damage the liver. Even though we have so much of safety data coming in to show that it's absolutely safe, still there is the kind of fear that what if it does cause damage. So we simply tell the doctors, why don't you just give it to your patient for 3 days? It just takes 3 days for the patient to show improvements in their fatigue. Is this little pill going to cause damage in 3 days? It's not. Just give it to your patient. But still, that's that kind of resistance is very, very strong.
And I wanted to mention something about after being a student of yours for quite, I think, almost half a year now, is that your depth of understanding of immunology and inflammation and what goes on within the body and how it interacts with remedies, homeopathic, herbal, and also our general supplements that we are giving to patients is really mind-blowing. I had a question about specifically when we get vitamin C from the usual ascorbic acid form. I've heard something along the lines of it's not really being absorbed by the cell. It sits on top of the cell, and amla is a natural form of vitamin C, if I understand correctly. Is that correct?
So amla is a natural form of vitamin C when you take the wet form of it. So that means you've just taken an amla and you've chewed it. That is going to give you vitamin C. But when you take it as an extract, like our pill has an extract of amla which we've made, that pill will have absolutely no vitamin C in it. So when you take an amla pill, remember it is going to give you zero vitamin C, absolutely zero. Not one molecule of vitamin C is going to come out from it. Okay, so don't ever think that amla is going to give you vitamin C, because it absolutely doesn't unless you have the raw version. The moment it is dried, the vitamin C is gone.
So much we don't know.
Yeah, and instead of taking ascorbic acid, which will cause you acidity, you should ideally be taking sodium ascorbate, which will not cause you the severe acidity that ascorbic acid causes. In our group, we just discussed a case in the afternoon where one doctor in the group had a case who was having kidney failure. The patient's creat was going higher and higher, and they were having heart failure as well. The ejection fraction of the heart was around 29% or so. After about a month of Imusil and one other agent of mine called as Clotho, which improves kidney function, the ejection fraction went to 45%, and the kidney failure has improved dramatically, where the patient is having more than a 30% drop in their levels of creat. So simply by taking care of oxidative stress, which is a major problem that happens in our bodies as we age, we can reverse or prevent so many of our diseases. And we are taking so many antioxidants every day, pumping our body with vitamin E, vitamin C. They're not going to do any good to your body, because you have to control the enzyme which is creating the oxidative stress. Targeting those end free radicals is not going to do you any good at all.
So, sorry, Dr. Tariq, Dr. Julie, is that okay? Are you done with your question?
Yeah, no, but I just want to echo that I hear you. It's basically a difference between fishing someone out of the river and stopping them from jumping in the first place. And yeah, I just wanted to put out an invite to anyone, whether you're a health coach or a doctor. I mean, Dr. Tariq's knowledge is extensive, and we have several avenues for you to interact with him. for a very reasonable price. And I just wanted to invite you to connect with us.
Absolutely. So viewers, do connect. This is a global platform. As we said earlier, we have people connecting from most of the countries over the globe, I would like to say, and we're getting such international stand on this, recognition on this, so people from all over the world can connect. And please do connect, because this is an amazing topic and amazing information that is being shared on Healing Our Earth that can benefit thousands and thousands of people. So connect with us and get this information. And also on this particular topic, connect with Dr. Tariq, because he's got this magic wonder that he wants to spread all over the globe. Dr. Tariq, so my next question was, while you were conversing about amla, I just picked up on something that, yes, we all know that amla is very rich in vitamin C, but you said the moment it goes dry, you lose the vitamin C content. Is that correct?
The moment you have a dried version of it, or you take an extract of it in a pill, it has no active vitamin C at all. It is basically having tannins which affect a receptor known as a fascinoid X receptor. Amongst all the other different things, there are certain molecules in it which target that particular one. And when you target that receptor in your liver, it helps your liver to start burning fat molecules off, which is why amla is also taken as like a slimming pill in India. But it has no active vitamin C in it at all.
So, you know, there's maybe then this is a myth that a lot of people have amla after dinner, or they have it with soft, as you can have it later on. They keep it in a small plate, and then they say, oh, take this amla, which is either sugar coated or salt coated. And they say, here, you should take amla. This is very good. It will help you with vitamin C. So is there any merit to that?
If the amla was fresh and if it was not dried, it has vitamin C, as I said, but the moment it dries, it's all gone.
Yeah, so I'm talking more about the dried one. So it's definitely a myth that we all think that, oh, the dried amla is going to help you with vitamin C.
Yeah, it has no vitamin C in it.
Interesting. Okay, lovely. Dr. Julie, lovely comments on Dr. Tariq. And yes, we can see that the knowledge that you have, Dr. Tariq, is amazing. The research you have done. It's also amazing that this kind of information, and it's still early days with COVID, I can say that 2 years down the road, normally a pandemic would last about 2.5 years, and then we start finding so many different things about it. But you're obviously quite a big step ahead. I also wanted to ask Dr. Julie, you said Imusil was available before this particular paper was published. So it was available in Malaysia, is that correct?
Yes.
And was it being widely utilized by the population there, or were you prescribing it, or what was the deal?
We were a small group of doctors being trained by Dr. Tariq. We were using it for all kinds of things. Yeah, as Dr. Tariq has mentioned. Yeah.
Sure.
We were using it for COVID, long COVID, fatty liver, cancer cases.
Yeah.
For lots of different cases, and also as a health supplement to patients, just to improve their fatigue levels. About 60% of the population, if you ask them what's your most biggest problem, they're like, I'm tired all the time. They just have chronic fatigue. So it's not just because of COVID in general, because of oxidative stress, they have chronic fatigue.
So one could take Imusil regardless of one having had COVID or not.
Yes, absolutely. You can simply take it so that you don't feel tired. That's the most important reason why you should be taking it.
Wonderful. Well, I'm definitely getting one then, because I constantly feel tired and I haven't had COVID.
Yeah.
But lovely. What an amazing discussion with Dr. Tariq and all his knowledge that he has on immunology and the product that they have come up with, Imusil. Ladies and gentlemen, viewers online, take note of this, get connected with Dr. Tariq and see how far we can send this Imusil to actually get us all energized and not feel the chronic fatigue. I think that's the main reason why I would want to take it. And obviously there's scientific basis proven with good experiments that this particular medication has got amazing effects with it. Dr. Tariq, thank you so much. We also have a couple other people on here. Mr. Rajiv Gupta, if he's available, we can. Great. Actually, moving on, not from Dr. Rajiv Gupta, we'll be taking on with him a little later, but we are